during the Congress. We've presented the work that we have been doing during the last 5 years in order to establish a program to treat patients with neoantigen reactive T cells. So tumor infiltrating lymphocytes, it's a therapy that it's becoming a bit more in stage, let's say. It's a therapy that where you get part of the tumor of the patient, you isolate the tumor infiltrated lymphocytes, and then you expand them in the lab and give them back to the patient after giving some preconditioning chemotherapy, and then you administer interleukin-2. There have been important successes mainly in the area of melanoma tumors, but there is some evidence in other tumors. What we know more is that what it appears is that those patients that have a more neoantigen reactive T cells are the ones in melanoma that are actually going to be able to respond better. So the hypothesis is if we are able to enrich the TIL product with these neoantigen selective T cells, we could perhaps increase the number of patients that would respond, mainly melanoma patients that have progressed already on checkpoint inhibitors, or even have expanded access to other epithelial tumors that are less immunogenic or less respond well to TIL therapy. So during the presentation in ESMO, I explained how during the last years we have been collecting samples from the patients that we treat in the unit in order to actually establish if we could isolate these tumor-infiltrated lymphocytes from normal biopsies of patients instead of from resected tumors, which is always a burden for patients. And we did expand it in over 140 patients, and we did manage to find this neoantigen reactive T cells. So we do the sequencing of the tumor. We perform a technique that we call in tandem mini genes in order to select what we think it's the most common neoantigens, and then present them in B cells of the tumor, and then we cross-react the tumor-infiltrated lymphocytes with these B cells in order to see which ones create reactivity, and this will be the ones that we expand and then administer to the patient. So we've just started the trial. We are looking for, we've included patients in the first part to start looking for these neoantigen reactive T cells.